All right, back to the video.
That's like delivering a baby. Wow, that's a big ass implant. Oh my God, look at that. Oh, that is worse than I thought.
That is a textured implant, and so there is definitely a risk of ALCL, anaplastic large cell lymphoma, in this situation. So that's one main concern. And the other thing is, did you see when that implant and all that fluid's removed, how her buttock completely deflated? This is something we see when we remove breast implants as well.
Between the 600cc implants and the 500cc's of fluid, Jabrina's volume problem is much worse than I thought. Because how am I going to get enough tissue from such a thin girl to fill out that pocket and give her a good cosmetic result?
So what you essentially have is this massive skin envelope that has deflated and there's nothing inside of it. Now the thing that I would think of first would be to take fat from anywhere else in the body and to try to inject it into that area to see if you can fill it in. The problem with her is she's real thin and there's not a whole lot to take out. And so hopefully the auto-augmentation procedure that he's talking about may be able to help.
All right, so why don't we take this skin off, cut down to the fascia, and lift it up and rotate it over. You try to leave everything but the actual epidermis, the top layer of the skin. The problem is I need to get this more elevated to get this to rotate down.
This is called a random pattern flap, and as plastic surgeons, we are fully trained in creating flaps like this or moving tissue from one part of the body to reconstruct another. That is why it is so important for cosmetic surgeons like myself to undergo a full plastic and reconstructive surgery residency, because we are fully trained in reconstructive surgery of the body. So even though you may think that plastic surgery, cosmetic plastic surgery, is just boob jobs and facelifts and breast lifts, well, in reality, we use a lot of the actual principles of reconstructive surgery to do cosmetic surgery as well.
This in there, drop that down. You got something, right?
More than something.
All right, the question is this flap alive? Let's check it out.
Now he's worried that the flap may not survive, and what that means is you lift up that skin but you keep it attached to a certain amount of blood supply so that it stays alive. If there's not enough blood supply to a body part, the body part basically dies. And that's why, let's say if you take a string and you tie it around my finger, if it cuts off the blood supply, eventually that finger is going to die. Same thing with this tissue that he has basically rotated into position. If there's not enough blood supply there, that tissue can die, and if it dies, that can create an infection and other types of major problems.
Let's do the other side. So we've got the right one now elevated, which we can put into the old implant pocket, just like we did with the left one. Okay, let's see what this looks like. Huh?
It's good projection.
Just green has got back.
That's enough.
Got
I gotta hand it to Dr. Dubrow. This is a real cool way to use the patient's own tissue to auto-augment the buttocks and give the buttocks a much nicer shape. The question is gonna be, how's it gonna look like with this tissue, and is it enough to fill out her buttocks like she wants?
Hi, Jabrina. Hey, how are you?
Hi.
Wow, the asymmetry's starting to go away.
Yeah, it's looking a lot better. I mean, this really did go down. Remember we saw her? It's perfect.
Now you can see that she does have a scar at the top of her buttocks. That scar is permanent. It will never disappear.
So tonight, I get to put on my nice fitted dress. I finally get to, show everybody what Dr. Dubrow did. And they're gonna be amazed. Since the surgery, I feel confident and happy. I don't have to hide and put on layers of clothing anymore. I don't have anything in my butt to make it flip. No discomfort, no pain. It's just me and my booty. Before my surgery, I had a saggy butt and the implants were flipping. But now, thanks to Dr. Dubrow, I am finally free of my honk butt, and now I finally have that cute toot butt that I've always wanted.
Kudos to Dr. Dubrow. He took what is essentially one of the most difficult scenarios in plastic surgery and got, I think, a reasonable improvement for her. Well, did you enjoy that reaction to botched? Well, if you did, I have an entire playlist of botched reactions, and some of these botched operations that they're fixing will blow your mind. Take a peek at it right up here where I react to multiple episodes of Botched in this playlist. And remember, eat real food, use clean skincare, and always consider actual plastic surgery as a last resort.